With just over a month left until Election Day, President Donald Trump was diagnosed with the novel coronavirus, pulling a sudden break on his campaign for re-election. President Trump has been at the Walter Reed National Military Medical Center due to the abundance of caution, according to the White House, which has generally given the impression that the president isn't in too much discomfort. And the president himself, just a few hours ago, posted a video on Twitter indicating that he's doing rather well and went to wave at his supporters outside the medical center. But US media reports say that his oxygen levels actually dipped twice and suggest that the president is doing worse than what his doctors are making out. There's also the question of whether he would recover politically even if he beats the virus after months of downplaying the severity of the virus and dismissing face masks, only to contract the illness at this critical time. To discuss this, we are joined by Dr. Stanley Perlman, Professor of Microbiology and Immunology at the University of Iowa, who has been studying coronaviruses for nearly 4 decades. We also connect with Charles Zeldin, Professor of History and Political Science at Nova Southeastern University. It's great to have both of you on today for the programme. Thank you very much for joining us. Well, let's start with you, Dr. Perlman. Well, if we think about the British Prime Minister Boris Johnson, who himself contracted COVID-19 a couple of months ago, he was initially seeming to handle the virus quite well, but later he had to be moved to intensive care. Do you think it's really okay for President Trump at this point to be discharged as early as tomorrow, as his doctors are saying right now?
It's really hard to know because the information we're getting, as you were alluding to, is really somewhat contradictory. In general, patients who have COVID-19 go in several different directions. Some people do very well and get very mild disease and recover very quickly. Other people, though, after having mild disease, they progress to much more severe disease, and sometimes they end up in the intensive care unit. So we don't quite know where we are right now with Mr. Trump's illness. So, because we hear one thing from the White House and the other thing from various experts in the field and from the media. So if he, in fact, is going to get worse, then he's not going to go home tomorrow, and he shouldn't go home tomorrow.
And really, this was very massive news all around the world over the weekend. And Dr. Zeldin, how has this news that President Trump contracted the virus really affected Capitol Hill and news of him returning to the Oval Office as early as tomorrow, which would be Monday in the US? Do you think this will calm things down, or will it only really add to the disorder that you're seeing right now?
I'm not sure if it'll add to the disorder, but it's not going to calm things down. The problem isn't, can he go back to the White House? The problem is he caught it in the first place. And he caught it in the first place because he ignored CDC guidelines. Remember, his government's guidelines to social distance, to wear masks, and to be careful about contact with other people. They held events where you have people right next to one another, no masks, people hugging, people touching, and surprise, surprise, people got the COVID, and it ultimately got to the president. That's the part that people are going to remember. One hopes he'll be able to go home and be well, but even if he were to miraculously bounce back and say, ha-ha, I'm fit, I'm good, it still doesn't take away from the fact that he never should have gotten the COVID in the first place if he had followed the guidelines his government had laid out.
And Dr. Perlman, of course, the exact details on President Trump's condition, they are still quite murky, but Trump has been given an antibody cocktail and is being treated with remdesivir, according to the doctors. And, well, what does this really consist of, and how does it work?
Okay, so he's basically received almost every therapy that people have thought about, none of which have actually been FDA approved. But the first one is the remdesivir, which is an antiviral therapy. Most people who get it, who are not the president, get this when they're sicker than he is. I personally think it's going to have its best chance of working if he, in fact, is given it early in the infection like he is. The antibodies also should work best early in the infection before there's lots of virus in the person who's infected. So both of these together should help. But there's always an issue with people getting what's called VIP medicine. So we see that in my hospital, and as a physician, I see that as well. So if people are considered VIPs, they often get everything when everything isn't the best thing. So he received the highest dose, for example, of the Regeneron antibodies. This is the dose that has the highest side effects. Whether he'll have those side effects, I don't know. Remdesivir, I think, is fine. Again, usually people get it when they're more sick than he was reported to be. And then the final part, the corticosteroids, are really a mystery because those are given to people when they already are seriously ill. During the SARS epidemic, we know that if it was given to all comers, in fact, the general outcomes were worse getting steroids because we know if you have mild disease, it could actually impact clearance of the virus and people can get worse. So it's used mostly now in people who are pretty sick, either in the intensive care unit, on a ventilator or not, and it seems to help some of those people. So his receiving it at this stage just doesn't make sense to me. It either says he's much sicker than what we're hearing, or in fact he's not getting the very best medical treatment, perhaps because he's being treated as a VIP.
And Dr. Zeldin, how has this really affected President Trump's re-election campaign, which of course was all about very huge en masse rallies, as well as his invincibility against COVID-19? Do you think this will greatly affect the swing voters?
Well, for those who support the president, about 1 out of 4 Americans, no impact at all. For those who oppose the president, about 5 out of 10 Americans, not at all. But for that 1 to 2 people in the middle, it might. The president's sales pitch was the COVID infection is going to be temporary. We're going to bounce back. Everything will be back to normal. And in that situation, just wait it out and things will go back to the way they were before COVID. The fact that that's not happening, the fact that the president caught it, only points out how serious this could be. And that undermines his argument because ultimately what COVID has done around the world has been a test of leaders' ability to lead. And to date, the president hasn't done very well, given the high number of infections and the high number of deaths in the United States. And his only real sales pitch was, yeah, but it's getting better. Well, when the president gets sick, it's not getting better. And I think that's going to have an impact on that 1 to 1.5% of the voters who might be able to shift their vote for or against him.
Well, in this video that he posted just a couple of hours ago, he said he learned a lot about COVID-19 and will be informing us later. So I suppose we'll have to see what he learned through that experience. But, well, Dr. Perlman, we can see that the president really is itching to go back to the rallies, go back to the Oval Office. But first, how would President Trump, how long would he have to quarantine and what procedures would he have to go through before it's really medically deemed safe for him to return and actually go out to the rallies again?
Yeah, so if somebody gets infected and it's day 1, let's say, and the person gets better quickly, then usually what we say is those people have to be quarantined for 10 days. And because we know the virus, people are not infectious usually after day 9 and even earlier. So at day 10, he won't be infectious to other people. He won't be contagious. And then we also ask them to have a day or 2 of no fever. And then they can go back to normal society. So at least 10 days from the beginning point. I'm not sure when the beginning point is for the president. It might have been Wednesday. I'm not sure. But 10 days would be the time. And of course, if somebody's sicker than that, then those rules don't apply. So if somebody's had more severe disease, they could, in theory, spread the virus longer. That's less likely, but they're going to be sicker, and they should be quarantined and kept away from others for longer than that, sometimes up to 3 weeks. So it really depends on how his disease progresses. Certainly for somebody like the president, who's both the age at which people get more severe disease. We know that people over 70 get much more severe disease than those younger, and also people have comorbidities, and he has the comorbidity of being overweight. So I don't know if he's formally obese or not, but certainly that's considered the major risk factor for worse disease, no matter what age you are.
And Dr. Zeldin, let's say that his quarantine period does stretch out even maybe up to 3 weeks, as Dr. Perlman has said might be the case if his condition gets really bad, like some patients have seen in their recovery process. But if it does stretch out for that long, then how would this really affect his campaign for re-election? I mean, what are the... Yes, please go ahead.
It undermines his model for the campaign, which was to actually ramp up live rallies, getting his voters enthused, reaching out to voters who might vote for him but aren't so sure they're going to vote, and get them enthused. The president has about 40% of the electorate locked in. He needs about 48 to 50% of the electorate, which means he's got to find a way to convince 15% of the American voters to not only show up to vote, but to vote for him. And his model was get out there, pound the streets, hold rallies, be the active one. If he's sick, he can't do that. If he's does that and he's not completely healthy, and other people start getting COVID as a result of this, that undermines him again. So he's kind of put himself into a corner in terms of how he hoped to run, and now what he's going to be able to do in the last month of the election.
And Dr. Perlman, you did mention some risk factors that the president has in terms of recovering due to his health, and the questions around whether he is morbidly obese or not. But with these concerns in mind, what would be your medical advice for the president and his campaign helpers, I suppose, as he continues his run for re-election?
Well, you know, ignoring the issue of whether he's contagious or not, which is certainly an important issue, somebody who is sick and getting better, what you tell them, you tell anybody to do is rest and recover your full strength. You don't tell them to go out and give speeches and mingle with lots of other people. You just need to rest and feel better, especially this disease where the people are having long-term effects that are not really completely defined yet, but a lot of people have long-term tiredness, they have trouble breathing. You can see with Boris Johnson, he recovered, and I don't know if he's back to normal now, but for the longest time, he was definitely not back to normal, even though he's back at 10 Downing Street and working. So there's some issues here about what actually, no matter what President Trump wants to do, what he actually can do.
And Dr. Zeldin, how do you think Trump will come back from this illness? Do you think he will come back stronger and more defiant towards masks and continue with his, his campaign as the strongman, or do you think he's going to change his tune?
Given Donald Trump and his propensities, I think he's going to come back ever stronger. He's going to say, look, I bounced back from it. He might say, masks are important, but then again, it's not really that bad. Look at me. And he'll go out and he'll push hard and probably make himself sicker in the end. But that's just his personality. So I don't expect him to learn many lessons from his bout with COVID. And also, he's running out of time, so I think he's going to feel the need to push hard. He has a message, and switching that message isn't going to be something he wants to do. And given the lack of time, given that people are voting right now, I think he's going to do everything he can to get his message out there, which is everything will be better. I did great before COVID. I'll do great after COVID. Vote for me. And he can't do that if he's hiding behind a mask, or at least in his own mind.
And Dr. Zeldin, after the debate with Joe Biden last week, that debate, of course, drew a lot of criticism. And the opinion polls, for President Trump, his rating seems to have gone down. And well, do you think this COVID-19 infection is going to worsen the public sentiment towards the president?
I don't know if it's going to worsen the sentiment, but what I think it will do is sort of lock things in for another week or two of people voting, another week or two closer to the election. Remember, currently, according to the polls, the president is behind. He needs to figure out how to get an additional 15% of the electorate to vote for him. people who are either undecided or in many cases leaning towards Joe Biden. And he's got to find a way to get them to vote for him. So in this case, a tie is to Biden's benefit if nothing much changes. And so at a minimum, I don't see this changing much. But, you know, there might be a bit of a bounce back saying, the president, he was sick. But I think more people are going to look and go, he did it to himself. And that's more likely to lock things in the way they are. And as the current numbers are showing, both not only in national polls, but also in swing state polls, that's not good for the president because Joe Biden's ahead, in some cases by 5, 7, 10 points.
Well, we'll really have to see how the president recovers medically and politically from this virus and whether, of course, he chooses to do so with or without a mask on. But this is where we'll have to end the discussion for today. That was Dr. Stanley Perlman, Professor of Microbiology and Immunology at the University of Iowa, and Dr. Charles Zeldin, Professor of History and Political Science at Nova Southeastern University. Thank you so much for joining us.
Thanks for having me.
And to our viewers, thank you very much for watching. We'll be back at the same time tomorrow here in South Korea with an analysis on whether North Korea may be planning an October surprise around its key political anniversary. Hope to see you then. Have a lovely day or evening wherever you are. Goodbye.